Dr. Mary Taylor. Good morning, ma'am. How are you? It's good to have you.
Thank you.
How long have you been there?
I've been there about 10 years, but I'm from Mississippi and went to medical school here, so I'm back home.
What great city in the state are you from?
Natchez.
Natchez!
That's right.
Don't you get it when somebody says that in the national?
Yes.
They're either from Coahoma County
Not
or
from
Natchez.
around here. That's right.
What's the other? Well, they don't even try Kosciuszko. They stumble over that one. But there was another one. Oh, it's Biloxi.
Yes.
They do Biloxi. All right, tell me, because there are so many things going on at the UMMC in the children's unit there, but tell me a little bit about the overview of how things are now.
Well, things are going really, really well. We've had a little bit of a struggle during the COVID times, but we moved into our new expansion right in the middle of COVID in November of last year.
That must have been interesting.
It was very interesting, but it was very successful. Went without incident, and we've been really blessed to have this new expansion for children in Mississippi, thanks to Sanderson Farms and Friends of Children's Hospital.
Doctor, what has it meant to you as far as the additional patients, putting additional patients in there?
Well, it's really given state-of-the-art care to the families and children of Mississippi. We have a new imaging center specifically for children, new intensive care unit for children with cardiac problems or medical surgical problems.
Is that new or updated, or you did have one before?
Updated and expanded.
Okay.
All the rooms are individual patient rooms with a bathroom and a shower in every room. So if someone's coming from the Gulf Coast or Tupelo or anywhere far and wide, they'll have a place to stay. The family can stay with them. There's other amenities for families with washer and dryer and kitchenette. And we have the same for NICU, the neonatal intensive care.
Yeah.
So we have 2 floors that are for NICU patients, so 92 beds. So it's really an amazing facility, also a new clinic building, so it's really spectacular.
One of the scariest things, and we've done so many interviews during this pandemic with the doctors and Dr. Dobbs and all of the rest of the good people, Dr. Woodall, all of them from the hospital. But when you start looking at the number of kids out there, it just seemed that the Delta variant is kind of raised the alarm on that. And then I guess it's the same thing for you guys?
Right. During the first surge, we really didn't have that many patients with COVID in the children's hospital, and we actually helped take care of some adult patients. But during this Delta surge, we've had a lot of children with COVID-19, including many in the intensive care unit and on mechanical ventilation. I think this week we've even had as many as 5 or 6 in the intensive care unit.
Is it a combination of the respiratory ailment with COVID, or COVID by itself, or maybe some other ailment?
Sometimes there's some other conditions like asthma or some other things that are going on, and sometimes they might have another virus like RSV has been very common for some reason this summer. But
that is a
pretty
scary
serious
thing.
Yeah.
Well, is it kind of like also in the adult patients where maybe the family lets it go a little bit longer than it should?
Well, I think it's more that children aren't eligible for vaccines at this point, under 12.
Yeah.
So a lot of the vulnerable children have been a little bit more exposed, so to speak. And some of them do have other problems and other conditions and set them up for infection. And sometimes it's not even recognized, as you said, until it's kind of a little bit far along.
I think one of the things, and I said this early on, because I'm pro-vaccine, we've had the 2, I've had the booster shot, and I would wish people would go on and consider getting it when they're holding out, and I understand that. But I don't want to be a hypocrite when it comes to my grandchildren who are like 3, 4, 5 years old, up to 10 years old. I worry a little bit about that, and I've asked. Because we have a good family of doctors that are part of this family on SuperTalk, and I've asked them point blank, would you give it to your daughter or your granddaughter? And they have, without hesitation, said yes.
Yes, definitely yes. I mean, it's a pretty serious illness, and children can definitely get sick, very, very sick, critically ill. So I definitely would suggest anyone who's eligible to get the vaccine.
I don't want to scare people, but is the statistics coming off that ventilator about the same as adults?
It's a little bit better than it is in the adult population, but they can have a very prolonged illness and have some chronic problems afterwards, too.
Have you seen some of those problems? Are they talking about that as far as long-term in adults also?
Yes. There's
things that we don't even know yet.
Right, and children are also susceptible to some some other problems. There's a condition called MIS-C. It's a cardiac condition. We have several children that we're following in a special clinic for those kinds of patients.
Is that heart swelling? Or
Some inflammation of the heart.
Is that temporary, or how long does it last?
It's usually recoverable, and they get better over the course of a few months, but they can have some long-standing problems.
Have you seen some long-standing or long-term damage done to the lungs?
Yes. Children, especially if they've been on a ventilator, can have some long-standing problems and end up on oxygen and that kind of thing.
Is there rehabilitation or therapy, physical therapy needed?
Yes, and they'll be in therapy for quite some time and see us in clinic and come back to our clinic space. We have, as I said, a multidisciplinary clinic for the MIS-C patients that we're seeing right now.
God's work every single day over there. I want to ask you this: how's your staff look?
Everything's going very, very well. Kind of nationwide, there's been a shortage of nursing and respiratory therapists, especially during COVID, but we're full speed ahead. We've been very, very busy lately. The hospital's been full. Again, we've been blessed to have this new expansion. Sanderson Farms and the Sanderson Farms tournament has really been invaluable in helping us get there.
Are the number of employees getting lost now lessening in the building?
Yes. Well, it's a pretty big space.
Yes, I understand that, and it took a while for them to get the map down, get their GPS going.
Right.
But it's got to be nice, though. I mean, you really got state-of-the-art equipment, and it's a beautiful facility. I've seen some of the pictures on the inside and a couple of the videos, and it is remarkable.
It's a beautiful hospital. It is a hospital for the whole state of Mississippi, not just for this area. So we see patients from the entire state.
Yep, all 82 counties.
All
You've
82
got a patient
counties,
list there.
exactly.
And that's been that way for a long time.
That's right.
How many kids on a yearly basis now?
Well, we see about 50,000 in the emergency room every year, which is quite a lot of patients. I'm not sure the exact number of patients per year, but we have about 220 or so patients every day in the hospital, 200 to 220.
When you talk about emergency room, though, at UMMC, and we're talking about kids, when they're coming from a great distance, is most of it air flight, or is
they come by ground or by helicopter? And then we have some that are from this region, that just come on their own vehicle. But most of the patients that are sent here come by ambulance or by helicopter.
From a variety of things, from accidents and everything else.
Right, everything. And if they need surgical care, for example, or trauma, that kind of thing.
Anything else?
It's the only hospital in the whole state of Mississippi for children.
Absolutely.
So we're really, really blessed to have it.
Well, I know that you want to tell the people in the 15 or 20 seconds we've got left, it's important, the charities are important, and your money is being well used.
That's right. It's been very, very well used. Thank you for everybody who supports us.
You got it, Dr. Mary Taylor.